Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. So today we are going to talk about small bowel obstruction, right? So regarding the diagnosis, how do we manage this case antenatally and what is the expectant management, right? So ileal atresia is the most commonest sort of an atresia which is being found in the small intestines, right? So this could be of multiple varieties. We can have a type 1, type 2, type 3A, 3B and 4, राइट बट मोटा मोटा ऐसा समझते हैं कि जो टर्मिनल पार्ट ऑफ द इलियम है वेयर इट जॉइंस इनटू द अपेंडिक्स एंड देयरफॉर द कोलन इज बीइंग फॉर्म्ड, तो उस एरिया पे जाके वी कैन हैव मल्टीपल सॉर्ट ऑफ एन एनाटॉमिकल वेरिएशंस एंड देयरफॉर इट लीड्स टू एलिलेट्रीज। सेकेंडली एनाटॉमिकल ऑब्स्ट्रक्शन भी हो सकती है, कभी कभार वेस्कुलर भी इंसल्ट हो जाती है जिसकी वजह से ये इलिलेट्रीजिया हो सकती है। यूजुअली दे आर वेरी लेट अपीयरिंग, समथिंग अराउंड 26-28 weeks for all these ultrasound sort of an features to appear and to really make a diagnosis. So meaning thereby that less than 20 weeks to make a diagnosis for an ileal it's really tough to take a call. And many a times these ultrasound features they really get established, राइट, जिसको हम हॉट डॉग या कॉफी बीन साइन बोलते हैं या कीबोर्ड साइन बोलते हैं, एंड देन दी polyhydramnios is also late appearing, right? And therefore we can have those dilatation of the bowel and so on so forth, right? So there are few things to talk about. हम ऐसा समझते हैं कि छोटी इंटेस्टाइन्स या स्मॉल इंटेस्टाइन्स की जो मैक्सिमम डायमीटर है वो 9 मिलीमीटर की होती है, और सिमिलरली जो लार्ज इंटेस्टाइन्स है इसको कोलॉन बोलते हैं, उसकी 19 मिलीमीटर्स होती है. So anything which is greater than 9 millimeters in a case of small intestines and 19 millimeters large intestine is something abnormal, right? So we are going to see one case and then probably we'll discuss out what are the different complications and how do we do an expectant management and how do we look around for it. So this is a case that we are seeing at 31 weeks, right? So outrightly हमको ये multiple segments of the small intestines which are midline they are seen dilated. ये coffee bean sign है, right? And then we've identified it to be different from both the kidneys and the bladder and all those stuff. So we've identified that this is the urinary bladder only. And we identify कि ये बिल्कुल एक ये coffee bean sign है and multiple segments are dilated. और अब इसमें जो बीच में कमाल की बात है वो ये है कि पेरिस्टालसिस दिख रही है. So peristalsis is a natural phenomenon of the gut to overcome that obstruction. तो वेव्स आती रहती हैं और वो उसको ये कोशिश करती हैं कि उस ऑब्स्ट्रक्शन को कैसे रिलीव कर ले स्पॉन्टेनियसली. सो दिस इज अ वेरी गुड साइन एंड हेल्दी साइन टू हैव a peristalsis, right? But the bad part is this that the largest diameter is something around 18.9 and 19 millimeters, which is large for the small intestines, right? And so this is an ileal atresia type we really cannot identify, and but we are having this multiple segments and all up to the stomach they are dilated, and we can see the multiple coffee bean signs, and we are having a huge peristalsis. The liquor is also slightly on higher side, which is a 20 centimeters, which is slightly higher for the gestational age, right? And so this is an ileal atresia, and as I've told you this could be of four variety like this. So the important point is this, that probably we have made a diagnosis of an ileal atresia. But definitely the baby would need a surgery after the baby is born, and probably we'll try to keep the baby nil by mouth, and we will not give anything through oral, and breastfeeding is also not warranted. पहला दूसरा मीनिंग देयर बाय pediatric gastric surgeon opinion, pediatric surgeon opinion is very very important and mandatory. बट जैसे हमने 31 वीक्स में इसको देखा है ना, हाउ डू वी फॉलो इट आउट अक्रॉस, जिससे मैंने आपको बताया कि 9 मिलीमीटर इज द हायर अपर लिमिट फॉर ए स्मॉल इंटेस्टाइन, एंड दिस इज 19 मिलीमीटर, राइट? सो दिस इज वेरी ह्यूज. सेकेंडली हाउ डू वी फॉलो कि जब जब भी जो बावल है वो ए पेरिस्टाल्टिक हो जाती है, मीनिंग देयर बाय कि दैट द इंटेस्टाइन्स ऑन देयर ओन दे आर ट्राइंग टू ओवरकम दैट ऑब्स्ट्रक्शन व्हिच इज लाइंग डिस्टल, और उसको वो ओवरकम नहीं कर पाती है, तो वो डाई डाउन हो जाती है पेरिस्टाल्सिस. तो ए पेरिस्टाल्टिक गट एंड लार्जली डायलेटेड, तो उसमें वो स्कीमिया हो सकता है, एंड देन वी कैन हैव एन सॉर्ट ऑफ एन गट परफोरेशन एंटीनेटली, और वो कुड बी सिनिस्टर, राइट? कुड बी वेरी सिनिस्टर बिकॉज वो सक्का सेंट्रिकस जो भी गैस्ट्रोइंटेस्टिनल जूसेस हैं, जो भी सब्सटेंस है, जो भी फीसेस है, मिकोनियम जो भी है, दैट वुड गेट स्पिल्ड ओवर इनटू द fetal abdomen, and therefore we can have a meconium peritonitis. We can have a lot of complications because of those gastric juices and enzymes which are available into the this thing getting into the peritoneum of the fetus, and therefore can lead to meconium peritonitis, right? So before all these things happen out, and we would be very very watchful for this aperistalsis to happen. In that case, probably this becomes an indication to do sort of to take the baby out as soon as possible, and to keep the pediatric surgeon informed, and then the baby might need some relief, right? You're getting my point. So that this dilatation of the stomach, this dilatation of the small intestines gets relieved, and therefore what we can do is this, that we can do an corrective surgery. Okay, corrective surgery would take some time, could be it depends upon the type, like what sort of an anatomical variation or anatomical obstruction that we are having. So we can have a defunctioning colostomy, and therefore the baby, and therefore we can have after the baby gains in some weight, and therefore we can have a anastomosis again and all those stuff, right? Okay, so इतनी बड़ी गट में एकदम से उसको कट करके और एनास्टोमोसिस करना भी बहुत आसान नहीं होता है। अगर वो गट पेरिस्टाल्टिक है तो आसान है, क्योंकि बिकॉज इन सब केसेस के अंदर ए पेरिस्टाल्टिक गट पोस्ट ऑपरेटिवली होना कॉमन होता है, और वो जो एनास्टोमोटिक साइट है वो लीक हो जाती है, एंड देयरफॉर ऑल these things they really can lead to a lot of complications. So a watchful expectancy to lead for to see for aperistaltic gut antenatally, even though postnatally अगर हमको ऐसा दिखाई दे रहा है कि the gut is not sort of an good, so उसको defunctioning colostomy करते हैं, and therefore we do a staged sort of an anastomosis at the later stage, at a later part. So ileal atresia are one of the commonest small intestinal obstruction. Peristalsis is a very good sign, but the bad part is this, that probably we are having the small intestines which are dilated really to a great extent, and secondly the polyhydramnios is also there. So with that we would have an IVGR to the baby also. So probably we'll keep a watchful expectancy so as to see the continuation of that peristalsis. Peristalsis हमको मिलना चाहिए जब भी हम अल्ट्रासाउंड पे बेबी को दोबारा देखते हैं, तो अगर ये पेरिस्टाल्टिक गट हमको मिलती है तो उस केस के अंदर ऐसा हो सकता है कि that probably will advise them to do an emergency delivery of the baby, and therefore a pediatric surgeon, मतलब we hand over the baby to a pediatric surgeon so as to take care for that baby, right? Thank you very much for your patience.